back to the sports pre-participation physical examination module. This is section 3, which will provide an overview of the physical exam stations. In addition, we will discuss practical tips for conducting exams and the importance of rotating through the stations to gain a comprehensive experience. The physical exam process is divided into 4 stations to ensure a thorough evaluation of each athlete. The stations are as follows. Station 1 covers appearance, eyes, ears, nose, throat, and lymph nodes. Station 2 focuses on the heart, lungs, abdomen, skin, and pulses. Station 3 is dedicated to the musculoskeletal exam and Marfan's syndrome check. And station 4 is the hernia checks, specifically for boys. To maximize your learning experience, we encourage students to rotate through the stations periodically. This will allow you to develop your skills across different aspects of the physical exam. For example, you can start the PPE event in station 1, and after a while, maybe an hour, hour and a half, you can switch to station 2. At the next PPE event, you could start at station 3 and then move over to station 4 throughout the event. It doesn't have to be in this order, but the idea is to get experience in all 4 stations. Now let's talk about attire and equipment. It's important that you wear scrubs, your white coat, and clearly display your name tag. You should also bring your state ID or a driver's license so that way you can check in at the campus front office. Regarding equipment, you'll want to bring your stethoscope, your charged otoscope, a pen light, reflex hammer, pen, and hand sanitizer. A portable clipboard is optional, but can be useful to support your writing. Upon arrival, you'll be provided with necessary items such as speculums for the otoscope, tongue depressors, and disposable gloves. The importance of these sports PPE events cannot be overstated. First and foremost, these exams are crucial for athlete safety. By identifying any potential health issues before they start the sports season, we can prevent any injuries and ensure that they are physically fit to participate. For U.S. students, observing and performing these exams provides valuable clinical experience. This will allow you to become more familiar with what's considered normal, and this will then enhance your diagnostic skills. It's essential to balance speed with thoroughness. While we need to be efficient, especially with large groups of athletes, we can't afford to miss any potentially life-threatening conditions. These PPE events typically take place in school gyms or locker rooms, which might not always be an ideal medical setting, but as the providers of these examinations, you'll need to be resourceful and adaptable. For example, you might have to use locker room benches, as you see in this image, or trainer room tables as examination beds. Here are some practical tips to help you conduct the exam efficiently. First, learn how to conduct thorough exams quickly without compromising the quality of the evaluation. This will come easier with time when you have more experience and develop smooth transitions through your exam. For example, performing all examinations that require the athlete to lay supine all at once before moving on to the next exam. Avoiding having the athlete sit and then asking them to stand, lay down, and then again, maybe sit, stand, lay down. This will save time and provide more comfort to the athlete. Always maintain a professional demeanor, ensuring that the athlete is comfortable and at ease during the exam. Be resourceful with the equipment and space that you have. If you are the last station, make sure that all exams are completed and signed off. If there are any documented abnormalities without a signature, locate the examiner or perform them yourself and then sign off on it. In terms of station rotation and initiative, work in small groups to avoid bottlenecks at the stations. If you see a station that needs more help, take initiative to assist. Remember, some stations require more students than others, so distribute yourselves accordingly if you see that another station needs more help. It's also important to be kind and act as a role model because the athletes are going to look up to you. So demonstrate professionalism and compassion. This is very important. If ever in doubt, don't hesitate to consult with the PA supervising faculty. The athlete's safety is always our top priority. Accurate documentation is also a key point. Make sure you document all findings properly using medical terminology. This ensures that there is a clear record of the exam and any findings. Reviewing vital signs is an essential part of the physical exam. These are usually already taken before the athlete begins rotating through the 4 physical exam stations. However, it is important to understand how to interpret and take appropriate action if needed. These particular age groups have normal blood pressure ranges that are different than the adult ranges that we are probably used to. For example, the normal blood pressure of a 12-year-old ranges from about 102 to 120 systolic over 61 to 80 diastolic. Accurate interpretation of these findings can sometimes make the difference between clearing an athlete for participation or identifying a potentially serious health issue. The checkout provider will ultimately make the determination for clearance in a case with significant abnormal vital signs. Documentation is critical in any medical setting, and the sports PPE is no exception. Ensure that all findings are recorded correctly and thoroughly. It's standard practice to initial for normal findings to confirm that the exam was completed and that no abnormalities were found. Always use proper medical terminology, like we've been saying. This will help maintain clarity and professionalism in the athlete's medical record. Let's go over a few additional key points. Always practice hand hygiene and sanitize your equipment between exams. This ensures a safe and clean environment for everyone. Effective time management is also crucial. You need to conduct thorough examinations within the scheduled time frames, so please try to stay on track. As far as emergency protocols, it's always important to be aware in case an athlete exhibits signs of a serious condition. And in those cases, you'll need to know the steps to get them the help that they need. First off, ensuring that the supervising PA faculty is aware and notifying the checkout provider of the situation. Remember that continuous learning is part of your growth as a healthcare professional. Reflect on each exam you perform and seek feedback, and use that to improve your skills. Lastly, maintaining patient privacy and confidentiality is a fundamental aspect of our role as healthcare providers. Ensure that the athlete's comfort and privacy are respected throughout the exam. This not only helps build trust, but upholds the ethical standards of our profession. To summarize, the sports physical exams are crucial to ensure the safety of athletes. Remember to rotate through the stations to gain comprehensive experience. Thirdly, balance efficiency and thoroughness. And lastly, ensure accurate documentation of all findings using proper medical terminology. These exams are an excellent opportunity for you to hone your clinical skills while contributing to the health and safety of athletes. That concludes our overview of the physical exam stations. Please complete the post-test for Section 3 to assess your comprehension. Next, we will be diving into the specifics of the appearance, EENT, and lymph node station, where we will cover the respective exams and procedures, common abnormal findings, and the red flags to watch for. If you have any questions, please send us an email. Thank you, and we'll see you in the next section.